place where you're physically ready to leave the hospital, but you're not ready to go home yet. So many people find themselves in that situation where you're in the hospital, they say medically you're good, but you're not ready to go back home. You can't go home and do the things you're used to doing. So here's the place where we work on it. We work on getting up, getting dressed, taking care of yourself, learning to walk again in some instances. We see many patients following orthopedic procedures, people after they've had a stroke, people who have certain brain injuries, pulmonary, cardiac issues, whatever placed you in the hospital. We keep taking care of that while you're here. We have round-the-clock nursing care, doctors that follow you, hospitalists that follow you here, in addition to the therapy that you need to get back home. We have physical therapy, occupational therapy, and speech therapy to address all your needs to take care of yourself and get back home.
An acute inpatient rehab setting is really unique. So you have patients that still medically need a certain level of medical care, but they also could benefit from intensive rehabilitation. There's a lot of things that set apart an acute inpatient rehab setting as opposed to like a skilled nursing facility level of care. It's two totally different levels of care. And so what we're looking at, medically, do they still need to have a certain level of medical care, but have they had a decline in function? What was their level of function prior to this event? And can we get them back to there? And so our primary goal is not to just meet their medical needs, meet their rehabilitative needs with the plan to go back home as independently as possible. There are many things that I love about Lanier Acute Rehab, and one of the things that I think really sets us apart is, we are a smaller unit. We don't take a lot of patients, but that just means you get more one-on-one attention, more one-on-one care. All of our rooms are private rooms, so that's really good when it comes to the recovery, and so patients have a place where they can relax and not have to be in a room with somebody else, or it allows them to have family members stay and stay overnight. Family training and having family involvement in their rehab is so vital to just to improvement and to trying to get them home and to have that support system. So having private rooms is great.
We try to mimic home as much as we can. People go home, have to do their laundry. We have laundry set up, we have walk-in showers, tub showers, a full kitchen, a regular bed, because it's not going to be a hospital bed when you get home. So we get to practice everything. Our local Kia dealer donated us a car, so that's a very specific thing of how do I get in a car that I haven't done since I broke my leg, and we can go out and practice that in real time with a real car, and that's a big difference than just getting in and out of a wheelchair. So unlike some other local rehabs, if you need something in here, you're inside a hospital already. So we've got radiology, we've got respiratory therapy, we have hospitalists, we have round-the-clock care, so you don't have to leave once you're here. We have amazing outcomes here at Lanier Acute Rehab. We are judged on kind of like a report card score. It's based on a bunch of different metrics: how many people go home, how much better we get, how fast we do it, and our overall report card score is in the top 10% nationally. That's us against 900 different programs, and we're in the top 10% for the second year in a row, and it's such a benefit to have that in our backyard right here on the Chattahoochee, and it's so great to have that in this community. I think being from this community, this is just a wonderful asset for this community to have.